Hello everyone, welcome to Midmind. Our today's topic of discussion is treatment of rheumatoid arthritis. Now, what is rheumatoid arthritis? It is a chronic multisystem autoimmune disease. Its clinical features are majorly persistent inflammatory synovitis in peripheral smaller joints. This is the major clinical feature. Other features are morning stiffness, joints become tender, warm, and swollen, fever, fatigue, and loss of appetite. Now, pain and swelling occurs due to prostaglandins. Disease progression is due to the release of cytokines. ड्रग्स यूज्ड इन द ट्रीटमेंट ऑफ रूमेटॉइड अर्थराइटिस. अब इसमें हमें तीन तरह के ड्रग्स चाहिए. फर्स्ट इज डीमार्ड्स, सेकंड इज एनएसएड्स, थर्ड इज ग्लूकोकॉर्टिकॉइड्स. अब ये जो डीमार्ड्स होते हैं दैट इज डिजीज मॉडिफाइंग एंटी रूमेटिक ड्रग्स. दिस कैन बी नॉन बायोलॉजिक्स और बायोलॉजिक्स. In non-biologics, we have methotrexate, chloroquine, hydroxychloroquine, sulfasalazine, leflunomide, gold salts, and D-penicillamine. In biologics, we have TNF alpha antagonist, interleukin 1 antagonist, T cell modulating agents, B lymphocyte depleters. In NSAIDs, we have aspirin, ibuprofen, diclofenac, naproxen, piroxicam, and etoricoxib. In glucocorticoids, we have prednisolone and methylprednisolone. Now, these DMARDs, they provide symptomatic relief as well as they decrease the disease progression. While NSAIDs, they do not stop the progression of disease, but they provide symptomatic relief. And glucocorticoids, they suppress inflammation quickly but does not stop the progression of disease. And its prolonged use can cause adverse effects. Now moving on to DMARDs. DMARDs are disease modifying anti rheumatic drugs. They relieve the symptoms and decrease the disease activity. And once a diagnosis of rheumatoid arthritis is made, patient should be put on DMARD. Now we'll discuss the DMARDs one by one. Firstly, methotrexate. It is the preferred DMARD. It has more rapid onset of action. It is a folate antagonist. It has anti-inflammatory effect. Indication: in what cases should it be given? In rheumatoid arthritis, psoriasis, polymyositis, giant cell arthritis, and dermatomyositis. What is its mechanism of action? It inhibits the chemotaxis of neutrophils and decreases the production of pro-inflammatory cytokines. अगर ये इन्फ्लेमेटरी साइटोकाइंस को कम करेंगे तो साइटोकाइंस क्या करा रहे थे? डिजीज प्रोग्रेशन, जिसकी वजह से डिजीज प्रोग्रेस नहीं करेगी. रूट ओरल dose initially 7.5 to 15 mg is given once a week, and if no improvement is there, dose is to be increased by 2.5 mg weekly. What are the adverse effects? Nausea, vomiting, and mucosal ulcers. The major thing to note here is dose dependent hepatotoxicity. इट इज़ वेरी वेरी इंपॉर्टेंट. मतलब जैसे जैसे हम डोज बढ़ाएंगे उसके ऊपर भी डिपेंड करता है कि टॉक्सिसिटी कितनी बढ़ रही है. देयरफॉर hepatic function should be monitored periodically. Adverse effects can be minimized by administration of folic acid. Why? Because it is a folate antagonist. Now, contraindications. It is to be contraindicated in liver disease, peptic ulcers, renal impairment, women planning pregnancy, and pregnancy. Now, next, moving on to chloroquine and hydroxychloroquine. We know these are anti-malarial drugs, but they are also used in rheumatoid arthritis. They are well tolerated. Mechanism of action: they decrease the release of lysosomal enzymes. They scavenge the free radicals. Important point to note here is they're highly bound to tissue proteins and are deposited in melanin containing tissues, especially eye. अब अगर में ये आई में डिपॉजिट हो रहे हैं तो व्हाट विल बी द एडवर्स इफेक्ट्स? कॉर्नियल ओपेसिटी, रेटिनल डैमेज. देयरफॉर ऑप्थेल्मिक एग्जामिनेशन शुड बी डन once a year. Route is oral. Side effects are nausea, vomiting, and skin rash. Chloroquine and hydroxychloroquine are relatively safe in pregnancy. Now next, moving on to sulfasalazine. It causes reemission in active rheumatoid arthritis. It is useful in chronic inflammatory bowel disease. Route is oral. Side effects: nausea, vomiting, skin rashes, diarrhea, and leukopenia. Now, sulfasalazine in the gut breaks into sulfapyridine and 5-aminosalicylic acid. Sulfapyridine is absorbed into circulation and it inhibits the production of superoxide and inflammatory cytokines. अब cytokines को कम करेगा तो disease progression को कम करेगा. Beneficial effect in rheumatoid arthritis. This 5-aminosalicylic acid produces local anti-inflammatory activity in the gut. Therefore, it is used in ulcerative colitis. Now next we have is leflunomide. It inhibits the enzyme dihydroorotate dehydrogenase जिसकी वजह से क्या होता है pyrimidine synthesis कम हो जाती है T cell proliferation inhibit हो जाती है It is as effective as methotrexate. Adverse effects are skin rashes, diarrhea, loss of hair, hepatotoxicity and leukopenia. Contraindications are children, pregnant women and lactating women. Next we have is D-penicillamine. It is rarely used because of its toxicity. Adverse effects are proteinuria, pruritus, pancytopenia, pemphigus like skin rash, thrombocytopenia and GI side effects. Now we studied about the non-biologics. Next we head on to biologics. हमने 4 तरह के biologics पढ़े थे. TNF alpha antagonist, interleukin 1 antagonist, T cell modulating agents and B lymphocyte depleters. We'll study them in detail. In TNF alpha antagonist, we have the drugs etanercept, infliximab, adalimumab, golimumab. Route is subcutaneously. Mechanism of action TNF alpha antagonist. Adverse effect they causes opportunistic infections. They are used in rheumatoid arthritis, psoriasis, Crohn's disease, and ankylosing spondylitis. Anakinra, it is given subcutaneously. Mechanism of action is interleukin 1 antagonist. Adverse effects, it also causes opportunistic infections. Uses in rheumatoid arthritis. Abatacept, it is given intravenously. It inhibits the T cell activation. Adverse effects, it causes opportunistic infections. And it is used in rheumatoid arthritis. Rituximab, its route is intravenously. Mechanism of action is B lymphocyte depletion. Adverse effect, it causes skin rashes. They are used with methotrexate in resistant cases of rheumatoid arthritis. Now we have seen about the DMARDs. Next we have is NSAIDs and glucocorticoids. In NSAIDs, they provide the symptomatic relief but does not stop the progression of bone and cartilage destruction. In glucocorticoids, they have prompt effects. They suppress the inflammation quickly but does not stop the progression of disease, and its prolonged use can cause adverse effects. So that was all with this topic. I hope the video was helpful. If you want the PDF notes, DM us on the number in the description box. For more such content, please like and don't forget to subscribe. Thank you.